Thank you for coming. My name is Charlie Conley, and I represent the Corpus Christi Parish and IBW Local 1768.
And I am Eunice Spooner from the First Congregational Church, Waterville, Maine, and I am also a direct care consumer.
Thank you for coming. We appreciate your attendance. I must say to start, if you were lucky enough to have you come up and speak, be careful that there's extension cords. We turn this hall into a sound system, so we don't want to see the healthcare workers in action. We just want to talk about it. So please, by all means, look down when you approach the microphone. Judy at this time is going to give us a declaration of the KVO, Declaration of Healthcare Principles.
Questions for the candidates. 1. General health principles and background. The Kennebec Valley Organization is made up of congregations, unions, professional associations, and community groups committed to the dignity and the freedom of all people. Although our member institutes represent people from different walks of life, we all share the same basic value that everyone should have the opportunity to get affordable health care. KVO members institute held out our healthcare story meeting this spring that included more than 100 of our people from Augusta to Skowhegan to discuss our values and share personal stories of healthcare. From these discussions and out of the issues arising from healthcare stories KVO collected, our leadership team developed 20 principles for healthcare reform. These principles are listed on the pink sheet, the KVO Declaration of Healthcare Principles. On June 18th, 40 of KVO's delegates and allies gathered at the First Congressional Church of Waterville to report on our healthcare story meetings. Learned about our current healthcare system and proposals for reform from the policy experts and advocates, and decided on guidelining principles for the KVO healthcare campaign. The Assembly reached consensus that the following 5 principles should be a top priority and serve as a foundation of our KVO healthcare campaign. 1. Healthcare is a basic human right stemming from the sanctity of human life. A just society must ensure that everyone receives compassionate, comprehensive, and competent health care, independent of employment, age, health, or family history. 2. Healthcare should emphasize prevention, and preventive medical care should be covered by every patient's healthcare policy. Affordability. Everyone pays based on financial ability. 4. Special effort should be made to provide care for geographic areas and populations that have been underserved, such as rural areas, inner cities, and impoverished communities. 5. Insurance companies and other third-party payers, the pharmaceutical industry, and other commercial interests should not function as barriers to care or impede the provider-patient relationship in making medical decisions. Now I'm going to ask the candidates all the same question. The first one is strictly a yes or no answer. The second part of the question, you'll have 90 seconds to answer, a minute and a half. So if we could start at my far right, would you come up, stand at the podium, and introduce yourself, please?
I guess sitting on the end. I'm Lisa Marichet, and I represent District 25, which is the Senate District of Waterville, Winslow, and up north, I-95 to Pittsfield. And yes, it's number 1. And if I was elected, what would I do? I would support these principles in the legislation that comes before us. We have a huge budget shortfall we'll be dealing with. So we will be keeping all these principles in mind as we try and make sure that when we have to balance the budget, which is required, that we do so keeping every single one of those 5 things in mind so that we have the minimalist amount of impact on people and their health care. Thank you.
Hi, I'm Steve Huber. I'm a candidate for District 4 over in Winslow. And yes, I do support the Declaration of Healthcare Principles. Healthcare is a basic human right, and just societies do ensure it. It needs to emphasize prevention and affordability by both people and corporations by their paying their fair share. It needs to include a special effort for the underserved, and insurance and pharmaceutical firms do need to be removed as barriers to these principles. I believe in all of these core beliefs, and I believe it comes from several different areas. One being my upbringing. My mom pretty much raised 4 of us boys alone. She's a saint. She did a great job. I believe that my involvement here with Immaculate Heart and going through the parochial school helped to strengthen those values. A second area would be the parenting of my son, who had special needs and certainly needed me as a single parent to advocate for his needs, and especially his health care needs. And lastly, my profession as a teacher here at Lawrence High School, serving the people. I've, from all these areas, learned how important it is to advocate for these principles.
Thank you.
Somebody anticipated my height, I believe. Thank you for the invitation. Yes, I do support the 5 principles. When we're talking about health care, there's 2 issues that always come up: the quality of the care and the affordability. The affordability generally is the largest barrier that people are having in Maine. And I think that the question about who's entitled, we're all entitled. What obligation do we have to the elderly and the sick? We have caring and with compassion. And in order to meet those goals, we have to ensure that the funds are available. And it really, sadly, comes down to money. It comes down to the commercial viability of it. It comes down to the portion of the budget that is available to support it. I don't think anybody will stand up and say, I don't want to support health care. I don't want to be sure that it's affordable. That is really a blinding flash of the obvious. But the issue is, we have to be in the legislature, and by the way, I'm sorry, I forgot my name. I'm David Carter, House District 55, China, Albion, Benton, and Unity Plantation. But anyone in the legislature, from either chamber, including the executive, they don't have a deliberate attempt to deny coverage to people, but they do have an obligation and a responsibility to handle and be stewards of the taxpayers' money so that affordable health care is available. So, again, it seems callous to talk about money, but there again, we have to make sure those funds are available.
But excuse me, what are you going to do
What?
to make this happen?
Oh, okay. Well, thank you. I'm sorry, was I wandering? What I'm going to do is, you have to identify issues where there are priorities that you do not agree with. There are only a finite amount of funds available. What am I going to do? I am vigorously going to oppose any squandering of the taxpayers' money. It has to be available to meet these clear human needs.
Thank you.
Thank you.
Good afternoon. I'm a candidate for House District 55, and this is the first time I've ever run for public office, and I'm a little bit nervous. Look, it's simple. It either is a right or it isn't. I mean, if it's a right, we have no choice but to pay for it. It's that simple, okay? The United States of America is one of a handful of countries, and it's not in good company, by the way, of people who don't even agree with the United Nations Human Rights Declaration because they declare things like this to be human rights, okay? Some people of a different philosophy would like us to think it's a human need and that there's a difference between that. I don't see that difference. If it's a human right, we have to pay for it. We have no choice. So, you know, we can mince words, we can split hairs, but shutting down Dirigo Health is going to put 18,000 people off health insurance. That's not the way to move forward. Okay, we need to believe in this. We need to adhere to this. We need to embrace it. And if we do, then we pay for it. It's that simple. The same way when people are in the way of a hurricane and FEMA goes in, because life is recognized by both sides, by both philosophies in politics as being a human right. So FEMA goes in and moves those people out of the way and provides them with ice and provides them with the things we need. Because life is a right, right? Well, so is this. So that's the kind of consequence that we have to pay for it. Something else has to go, fine. But to say that we have to find the money or we have to balance taxpayers' needs or whatever, no, we have to pay for it. It's that simple. Thank you.